High hamstring tendinopathy can sideline even the strongest of runners, but there's a lot of confusion around what it is and how you can actually treat it, and why runners in particular are prone to it. We'll talk about the essential role of the glutes and what happens when they're not pulling their weight. Plus, stick around to the end because high hamstring tendinopathy is something that is often misdiagnosed, and you can be going down a path that's not actually going to serve you best. So I'll give you a little bit of info of how you can tell if it's high hamstring tendinopathy or if it could be something else. This is one that a lot of runners can relate to, so share your story below, ask any questions, and leave comments. Don't forget to like, subscribe, and turn on notifications. Do you have a pain in your butt while you're running? Or have you had a pain in your butt while you're running? If you're a runner, you've probably experienced some type of high hamstring pain at some point in your running career. And you might think that stretching your hamstring is the way to go, but you are wrong. I am here to give you an answer. Let's first talk about what high hamstring tendinopathy is, what some of your symptoms can be like, what causes it, and then we'll dive into what it is you need to do to address it. High hamstring tendinopathy is an irritation of the tendon where the hamstring attaches to the sit bone or the ischial tuberosity. Now, the thing is that this can be related to a lot of different issues. It can be related to overuse, poor mechanics, decreased flexibility, decreased strength. And typically with runners, it's a combination of all of those. Now, what I'm going to do today is I'm going to tell you what it is you need to address that would help with all of those parts that's causing the high hamstring tendinopathy. The thing with a tendinopathy, it's different than tendinitis because the tendinopathy means that the tendon has changed structure, right? And that's what makes it so persistent. So if you've had this long-standing high hamstring tendinopathy, this pain in your glute, the pain in your sit bone, that means that the structure of the tendon itself has changed. So what we have to do is we have to restore that flexibility, get that muscle to activate the way it's supposed to, but then even more importantly, we need to make sure that the other muscles are on board in order to decrease some of the force placed onto that hamstring, so then we can have a more evenness in how you run. So what causes high hamstring tendinopathy? It would be tempting to say it must be your hamstrings, right? That's the really simple answer. Unfortunately though, that's not how your body works, right? So your body is a complex system, right? So it's not just one thing that causes the issue. Yes, your hamstrings can be tight, but the thing though is that it also can be that your hip flexors are tight as well. That throws off your mechanics in terms of being able to utilize your glute. So then your glute then is underactive. Or it can even be something like your calf is really tight, your ankle is tight, and that's what's preventing you from having some of those normal mechanics as well. And that is why runners end up getting this high hamstring tendinopathy, because the thing is that we're doing the same movement over and over again when we're running. We're doing one bad pattern after another, and then there's a cumulative effect. That's the whole idea of a tendinitis and a tendinopathy, is that you have repetitive strain that's irritating the tendon of where the muscle attaches to the bone. So what we need to do is we need to restore that entire system. So we need to improve some of that flexibility. We need to improve some of the stability and even the activation of the glute and working on some of the mechanics. Now, the thing though is that we have to go piece by piece, right? This isn't something that it's like you start doing every single thing all at once and now all of a sudden it's going to get better. You need to have a system in place. Now you can be saying, hey, but I don't actually have this pain in my butt that you're talking about. The best thing to do is to stay ahead of it. This is something that runners are prone to. So it's really important to make sure that all of that tissue is prepped in the way that it needs to be. So that's why doing things like foam rolling, stretching, and working on your mechanics is going to be really helpful for making sure that this doesn't develop. Aside from just mobility work, we need to make sure that we have adequate strength and stability. So that's making sure that your glutes are doing the work. And what that means is doing that glute work and integrating it into how it is that you're running. It's not enough just to do bridges and just hope that that means that your glute's going to activate. You actually have to change the way that your brain thinks about moving. So as you're running, you need to be thinking about, am I firing my glute as my leg is behind me and I'm in hip extension? If you're already dealing with high hamstring tendinopathy, the key is the proper rehab. So it's not just a matter of just letting it rest for 4 weeks. That can be helpful for reducing some amount of inflammation, but the more important important thing is you have to restore the system. You have to tell your body what it is it's supposed to do and how it's supposed to be activating those muscles, how much flexibility you need. And that's why you need a system to address the high hamstring tendinopathy at its core. So often runners will tell me that they've been dealing with high hamstring tendinopathy on and off for 4 years or 5 years, and that's unacceptable, right? Because what that means is that they haven't found the appropriate system for addressing the issue, and you need to be systematic about it. The answer isn't just doing glute bridges and clamshells. The answer is doing smart PT. So it's a matter of addressing the flexibility limitations in the hip flexor, being smart about how you're addressing hamstring length and glute flexibility, and then from there integrating that into some of the stability and strength work. Yes, that sounds complicated, but it doesn't have to be. You need someone who knows what they're talking about. You need someone who understands you, right? So you need someone that can take a look at what is your flexibility, stability, and strength like, and how is that being integrated into your running mechanics. You also need someone who can help you to systematically address all those issues. So you can't just start with changing your form if you haven't done anything to address your flexibility, stability, and strength. So I'm going to give you an idea of some flexibility, stability, and strength work that you can do, but know that this is a template. You might need something that's a little bit more specific to you. Over the years, I've tried out different things for myself in terms of what I find to be most helpful for me, but that's also different than what I give my other patients, right? So each person is going to need something different because the way that we run, the way that we move is going to be different from person to person. Plenty of runners have come back even stronger from high hamstring tendinopathy, but it's something though that you have to stay on top of. So for me, after every time that I do a speed workout or a long run, I have a set program that I do to kind of put my hamstring and my glute back on track. That's how I describe it, is that once I've challenged that glute and hamstring in that long run or in that speed workout, it starts to kind of go astray. So I need to do something then to say to it, hey, come back to center, make sure that you're working the way that you're supposed to, so then I'm ready for that next run. If I don't do the strength and flexibility work that I know that I need to do, I definitely feel it on my next run. So learn from my mistakes and just start with integrating this program. Now, what should you do about this high hamstring tendinopathy? I had told you that first you need to work on restoring the mobility, restoring the flexibility, but you're not just going to be stretching your hamstrings. I'm going to show you 3 different exercises that are going to help to decrease the amount of tension around that sit bone. There are 3 different muscle groups that attach to that sit bone, and we need to make sure that all of them aren't pulling on that area too much. We're going to work on the flexibility of the hamstring, we're going to work on the flexibility of the glute and the adductor muscle, the groin muscle. With all of these exercises, we aren't doing traditional stretching. What we're doing is we're either foam rolling or doing some type of dynamic movement. That's going to help to progressively challenge some of that flexibility, but without overstretching it. If you just do static stretching, you can actually irritate a tendinitis or a tendinopathy even more because the muscle belly itself is so tight that it's actually pulling more on that tendon, creating even more inflammation. Active release for your hamstrings will help to progressively improve some of that range of motion and decrease some of the tension throughout the muscle. So place the ball underneath the hamstring. Make sure you're sitting on something that's firm enough. Sit as upright as you can, and then you're going to bend and straighten your knee just to tolerance 5 times, okay? Then you're going to then switch to another area 5 times. Remember, the hamstrings run from the back of the knee all the way up to that sit bone. So you need to choose 5 to 6 different places, bending and straightening your knee 5 times in order to get all of that muscle to relax. I know that your hamstring pain is up in that sit bone, but you need to work on the flexibility throughout the entire muscle belly so then it stops pulling on that tendon. Make sure you sit on a hard enough surface and you use a hard enough ball. I'm using a field hockey ball, but a lacrosse ball is good too. But you need to have something though that isn't just going to get lost in the muscle of your leg. The other thing that's important is to not force that range. So you might not be able to fully straighten that knee. That's okay. So if at first when it's pretty irritated, if you can only straighten to here, that's totally fine too. You're going to sit as upright as you can because that's what's also going to help to challenge a little bit of that flexibility. We're doing this in a dynamic way in order to be able to introduce a little bit of range to that area, but not too much. The idea is that progressively over the course of 4 to 6 weeks, you're going to increase that range of motion, and that's what's going to help to decrease that pulling on the sit bone. Believe it or not, foam rolling through your glute is going to be key to addressing high hamstring tendinopathy. So the muscles that are around that sit bone, your hamstring muscles and your inner thigh muscles, they all attach to that sit bone as well as the glutes. So we are going to go over foam rolling for the glute. Okay, so I'm sitting on the foam roller with my knees bent. I'm foam rolling on my right side, so more of my weight is on this right side. My left glute is off of the foam roller. I'm gonna first start with just having my knees bent, and I'm gonna roll back and forth for a minute. And I'm going through the entire muscle belly. So I'm not just focusing just on that sit bone. I don't want you to just roll over that sit bone. You can actually end up irritating the tendon more. So we need to get all of that musculature to relax. So we're untying all the knots in that glute area. For a slightly different stretch, what you can do is you can cross that leg and roll through. You're going to end up feeling that in a slightly different area as well. So you're going to roll through this area for 1 to 2 minutes. The other surprise mobility exercise that you should do is foam rolling through your inner thigh. So your adductor muscles attach to that ischial tuberosity. So it's really important that you foam roll through that whole groin area. So I'm rolling through this all the way up into the groin, but also all the way down to the knee. That is what's going to be really helpful for getting all of those muscles that are around that sit bone to end up decreasing how much they're pulling on it. So I'm gonna roll through this inner thigh for 1 to 2 minutes. At the end of the 1 to 2 minutes, you can hold wherever it feels particularly tight, and you can bend and straighten that knee. So then the whole idea then too is you're getting that active release. As you're foam rolling through your inner thigh, make sure that both sides of your pelvis are pointing down. So what happens sometimes is people are turned toward their leg as they're rolling. The more actually that both sides of your pelvis are pointing down, the more you're going to get out of that foam rolling. In an ideal world, you would rotate between the hamstring active release with the ball, the foam rolling through the glute, and the foam rolling through the adductor for 3 rounds. Remember, for the active release for the hamstring, you're going to choose 5 to 6 spots and bend and straighten your knee 5 times. Foam rolling through your glute, you're going to take 1 to 2 minutes with your knees bent and then with your knee crossed over your other leg. So remember, if you're foam rolling through your right glute, make sure to cross your right leg, not the opposite one. And then you're going to foam roll through the adductor for 1 to 2 minutes. Don't forget that active release. As I talked about before, what happens with high hamstring tendinopathy is that we overuse our hamstrings and underuse our glutes. I love doing hip thrusts as a way of teaching someone how to activate their glutes. I actually find that it's easier to activate your glutes doing hip thrusts as opposed to bridges. So give these a try. For the hip thrust, you're going to have your shoulder blades on the edge of a chair, okay? So what you're gonna do is just have the tips of my shoulder blade on the edge of it. It could be chair, bench, this is a box. And now the thing that I'm going to be doing is that I'm going to be extending my hips, okay? So this is the idea. I'm keeping my spine stable this whole time, and I'm just extending my hips and coming back down. Now, my heels and my toes are pressing into the ground, and then as I'm coming up, I'm thinking about opening up this space. I'm not opening up my ribs, I'm opening up my hips that whole time. So what you need to be thinking about is when you start in this down position, you're looking straight ahead or maybe a little bit up. And then as I go to extend my hips, now I'm looking up toward the ceiling, okay? So my spine is staying stable and I'm just extending my hips. What happens is that as runners, we end up losing this ability to extend our hips. And then what happens then is we underutilize our glutes and we overutilize our hamstrings. So I really want to be thinking about firing this entire glute muscle, and I need to engage my lower abdominal muscles. That's what's going to help me to engage that glute as well.
Now, if you're having a hard time fully extending your hip, you may want to be focusing on a little bit of that flexibility through that quad and through that hip flexor. You're going to do 3 sets of 10 of these hip thrusts.
Now we are getting to the hard part. So this exercise, these kickstand RDLs are going to be helpful for not only strengthening and lengthening the hamstring, but also repatterning how you move. Let's forget about the weights for now, and you need to focus on how it is that you're moving. I am going to be ultra specific about this. I want you to listen to this entire thing because so frequently people do RDLs incorrectly. If you learn nothing from this video but this, I want you to learn this, okay? Here is an opportunity to change how you move, right? So we need to be teaching our body how it is that we flex the hip and extend. Flex, extend. What happens though is with high hamstring tendinopathy, we lose our ability to flex and extend. Actually, in particular, when all of this is so tight and irritated, we lose our ability to flex, to hinge at our hip. What we end up doing is we bend from our knees too much. And the other thing is that then we start opening up our pelvis. So we start doing this. So when people are running, when they're running, their hip is turning open as they run, or maybe they're rotating their body a lot side to side. Or what they're doing is they're doing what I call knee down running. So they're mostly just running here and their hips are barely moving. Where you gain power when you're running is by being able to extend your hip and then flex it. You need to be able to move from your hip like this. Kickstand RDLs teach you how to do that. The key though is making sure that you're moving from your hip, not from your knee, not from your spine. So let's go over it. So the first thing that I want you to think about is being able to do a 2-leg RDL. So my knees are slightly bent and I'm pushing my hips back and then I'm coming forward. This seems pretty simple, right? Because I can do it, right? My spine is stable, so I'm not flexing my spine. My pelvis is rotating forward and then I'm not bending my knees too much. So you see how my thigh bones are pushing back and then they're coming forward. Pushing back, coming forward, okay? Great. Now, we want to focus on one side. So now I'm just going to step this left foot back, just slightly. I'm going to push this hip back, and now I'm going to come forward. Now, here's where it gets tricky. Both sides of my pelvis have to be pointing forward. So when I'm here, I need to make sure that I'm pushing my hip back and I'm not turning open. This looks easy because I can do it, right? Especially on my right side, I can do it. That's why I'm showing you this. So I'm pushing my hip back. I'm not bending my knee anymore. My spine is staying stable, and then I'm coming forward. My weight is primarily on this right leg, okay? So this is the other thing that I see people do is they're just shifting back. That's not what we're doing, right? I'm keeping my weight over my big toe, the pinky side of my foot, and my heel. I'm pushing the hip back, and then I'm coming forward, okay? So then now on my left side, I have to be even more particular because this is my problem side. So when I go to step back and I'm pushing this hip back, what I can feel is I can already feel this tension through here. What feels easier is if I turn open to my right. So then, and if I bend my knee, now I don't feel that strain. But I'm gonna feel a little bit of a strain, but the whole point though is only go to your tolerance, okay? So I'm pushing my hip back and it's like, oh, this is getting kind of irritated. I can kind of feel this in my high hamstring area. So only go to there and then you're gonna come forward. You push back and come forward. This slow controlled motion, this eccentric motion, that's what's gonna help to realign those muscle fibers. It's going to help to strengthen the hamstring and introduce some range of motion. But the whole thing though is that we need to make sure we're moving correctly because we're changing how it is that you move. If you have high hamstring tendinopathy, you likely have difficulty doing this without some type of compensation. So you need to be thinking about my knees slightly bent, my weight is on this left leg. This is just for a little bit of balance, okay? And then I'm just pushing my hip back and coming forward. If you look at me from the front, what I'm doing is that both sides of my pelvis are pointing straight down. What will happen a lot of times is this leg will turn open. So now I need to really be thinking about this pushes back. Because the other thing that happens then is people start to side bend, so we need to keep our spine straight as well.
Now, once you get that pattern down, then you can use some weight. So now I'm going to do sets of 10. So I'm going to be hinging from this hip, pushing down, coming forward. This whole time, I'm going to think about squeezing that glute as I extend my hip, and then I'm slowly lengthening that hamstring, coming back down. And one side might feel totally different than the other. I always start on my right side because my right side's fine. The left side is the problem side. So I have to be a little bit more deliberate about how I'm moving. I need to take my time a little bit more. And I'm gonna do 3 to 4 sets of 10 total. So I might not use weight for the first 2 sets, and then I'll use weight for the next 2 sets. You might want to start with just doing these mobility exercises for the first week or 2. For a bonus, you can foam roll through the hip flexor and quad. That's what's going to be really helpful for making sure that you can fully extend your hip and activate your glute. Now, if you have a little bit less time, focusing on those other 3 are going to be really helpful for improving some of that flexibility. The best way to address this high hamstring tendinopathy is to do something consistently, right? So we're not asking for perfection. What we're asking for is consistency. I gave you 3 different mobility exercises with a bonus exercise. Now, if you choose at least 2 of those, it's going to help you tremendously. The best thing you can do is the thing you're going to do consistently. Don't skip this step of restoring some of this mobility before you start doing strengthening, because if a muscle is too tight, if it's too bound up, you're not actually going to be able to activate it as well. So we need to make sure that there aren't all these knots in the muscles, because it's actually going to help you to activate it better. The most complicated part about the rehab for high hamstring tendinopathy is changing how you move, right? So with these exercises, the thing that I want you to be really focused on is how you're moving each time you're moving, right? What we need to make sure of is that every time that you're doing an exercise, you're thinking, is this improving my running mechanics, right? So I need you to be very focused on how it is that you're moving. This isn't the sort of thing that it's like you're zoning out and just doing 3 sets of 10. You need to be thinking about, okay, am I activating my glute? Can I feel what this is like when I'm going to be running, when I'm going to be walking? That's actually how you change the motor pattern in your brain. This is a matter of changing how you move. That's what's really complicated. That's what ends up creating the biggest difference for someone. Now, this is an overview. Remember, each person is a little bit different. We each have a complex system, but this should give you a framework of kind of seeing what it is you need to work on. Remember, don't skip the mobility part and just go right for the strength, but you still need some amount of strength work. If I can give you one piece of advice, it's don't ignore hamstring tightness. You can save yourself a lot of aggravation by just working on some of this mobility and stability, so then you don't have to deal with high hamstring tendinopathy. Now, here's the part you don't want to miss. Sometimes you can think you have high hamstring tendinopathy, but what you actually have is gluteal tendinitis. They can present in a very similar way, but then after you've done all of this work where you're focusing on addressing the high hamstring tendinopathy, what you end up finding is that more of what you actually need to be working on is your glute. And there's some overlap between high hamstring tendinopathy and gluteal tendinitis. But if you end up hitting a roadblock, what can be helpful then is to switch gears and then to focus on one or the other. Starting with this is going to be really helpful for correcting your mechanics, generally speaking. And you can start to get an idea of what works best for you. In the next video, we are diving deep into gluteal tendinitis. So to recap, high hamstring tendinopathy can be something that is such a challenge for runners, but it doesn't have to be. With smart training, proper warm-up, and targeted exercises, this doesn't have to be a pain in the butt. Feel free to ask any questions and leave any comments, and make sure to share this with someone else, because likely someone that you run with has dealt with this as well. Have you yourself dealt with high hamstring tendinopathy? I would really love to hear your story. This is something that I treat so frequently in my patients that are runners, and I want to hear from you in terms of what your experience has been.